A renowned addiction doctor told the story of a patient who was a doctor himself. He had been clean and sober and successful for years. But when he was planning to go to a medical conference in Philadelphia, his sponsor said, "Don't go." Why? Because science has taught us that visual cues of drug paraphernalia or the surroundings where you used to use signal the brain to have intense, powerful cravings. Philadelphia was the place he used to use. Days later, the doctor was found dead from an overdose in his hotel room. To explain what's going on in the brain is Dr. Dennis Paul, LSU professor of pharmacology. Dr. Harry Gould, LSU health professor of neurology and neuroscience. They are both also experts on opioids as well and pain management. And Dr. Ross DeLeonardo Jr., assistant professor of clinical psychiatry who specializes in addiction psychiatry. Welcome, doctors. So what's going on in the brain? Why is it so powerful, sometimes one time, and someone's addicted? What's going on?
That's a complicated question. First of all, there's the reward mechanisms. When you're taking an opioid, you stimulate an area of the brain that signals reward. And for some people, for about 20% of the people, that's overwhelming. There's still, on the other end, 20% who feel relatively nothing, but most people feel very good.
So you're genetically predisposed, right,
yes,
to be more likely to use and more likely to become addicted. Is that accurate?
Right, well, I was going to say the reward mechanism is there for a biologic reason. It's so that we do things that we need to do, like eat, sleep, procreate. Those things are all rewarding, and they trigger that reward mechanism. What happens is when a person starts using things like an opiate, there's a derangement in that system where now things that once were rewarding, like good food, aren't as rewarding anymore.
You know, I hear so many people say, well, I would think that my husband would stop for the children's sake, but I keep telling them that this becomes the primary thing in their brain, more important than food sometimes. Is that accurate?
It seems to be the driving force to actually seek out the medications that they no longer need anymore, to keep them from actually being withdrawing or having the adverse effects of not getting that medication.
Let's talk about dual diagnosis. We're learning that a lot of people who have some type of mental illness, not hospitalized mental illness, they could have ADHD or bipolar, that they seek on the street self-medication to calm them, then they get addicted, then we have dual diagnosis. What can y'all tell me about that?
Well, one of the things that some of the patients will tell you is that this is what they have to do to feel normal. That's not only with opioids, but even things like cigarettes. I don't feel normal unless I'm taking this drug.
And so, go ahead.
And the drive is even stronger once you've gotten into it. The initial one, for a lot of people, initial response may not be as strong in a certain population, but for a small group, it is very strong.
And your brain changes, so you stop having enough of your own feel-good natural chemicals, endorphins, and you keep needing more and more from the outside.
Right, and what we find clinically is that people who have things like depression or anxiety are much more likely to use drugs or alcohol than are people who don't. And the reverse is true as well. People who use drugs and alcohol tend to have more anxiety, more depression, more mood disorders. And so it's kind of a vicious cycle that feeds into itself.
And the teen brain, oh, go ahead.
And what I see in pain management is that adds a third diagnosis to the dual diagnosis, because a lot of the psychiatric issues and behavioral issues tend to increase the perception of pain and how bad it is for them. So they're looking for medications, and unfortunately what we provide, or a lot of people provide for pain management, are things that feed the bad part of the system.
And we're talking about dentists who will give 30 days of opioids, of painkillers for wisdom teeth out, or football player gets banged up a little bit, and that's how they got addicted on prescription pain. And the teen brain is different. It's not until you're in your late 20s when it's completely developed where you can think, this is going to be bad for me, correct?
That is correct. The neurons are not fully developed until you're about 20 years old. All the connections, the neurons are there, but they haven't made all of the connections. And there's less of this thought that this could be dangerous. Essentially, they don't know that they can be killed.
Doctors, thank you so much for helping us understand. Thank you.
Thank you.
You're welcome.
If you or a loved one is a substance abuser, there is help. We explore some treatment options next.